So good morning. My name is Elizabeth Murphy-Lavallee.
Hi,
I'm a nurse clinician here at the Sakato Shibata McGill Health Clinic. How are you today?
I'm doing okay, thank you. How are you?
Good. So I see that you're coming. We're making a phone call because there's been a request for you to come and see a physician. I'm going to be doing an initial screening through our telehealth interview. And throughout the interview, I'll be asking you some questions about the reason why you're requesting a referral, uh, your health history, your family history, and also functional how you are doing on a day-to-day basis. If ever you feel not comfortable to answer any of my questions, feel free. You do have the right to refuse, and we'll continue with another question. Do I have your consent to continue?
Yes, definitely.
Great. So, may I get your full name, please?
Yes, my name is Jane Doe.
Hello, Miss. Would you like to be called Mrs. Doe, Jane Doe, Jane?
Jane is fine, thank you.
Jane. Perfect. What is your date of birth?
On May 1st, 1985.
And to put on my records, may I have an emergency contact?
Sure. We can put my husband down. His name is
Mhm.
Todd Doe, and his phone number is 514-555-2222.
Okay, great. Thank you. Mrs. Doe or Jane, do you presently work?
I am working. I'm a teacher at an elementary school. So we're not teaching at the moment, but we're preparing for the fall.
Okay. Oh, so it must be quite a busy time for you.
It is very busy, but
It
we're
must
all
be.
the teachers. We're working together to figure out what we're going to do and so that everything is safe for us and for the children.
Yes. So it makes a lot of preparation, but that will pay off in the long run. Let's hope for that.
I hope so.
So, could you tell me what brings you to consult us today?
Well, it's really, I've been having some right shoulder pain.
Mm-hmm.
And so I would just like to figure out if maybe there's something I can do to help it.
Okay, so the right shoulder pain, if you were just going to show me and point to me, where would
So if I
you have
can point
that?
exactly, it's right here.
Okay, so I'm just going to note that down. And when did this pain start?
It started about 2 days ago.
Okay, and could you just tell me how it happened?
Well, I'm not 100% sure, but 2 days ago I was doing some gardening outside and I was lifting some heavy items. And
Mm-hmm.
then later that evening the pain started. So I'm wondering if maybe while I was lifting something heavy, I maybe made a bad move that's
Okay,
caused the pain, but I'm not 100% sure.
and is that pain constant? Has it since 2 days ago, or is it off and on, so intermittent?
It's always there.
Okay. And what what do you do to help the pain go
Basically,
away?
I'm just trying to move that arm as little as possible. I've been applying some ice, um,
Mm-hmm.
and I've been taking Tylenol around the clock. It's
Okay.
a lot.
And do you know by any chance the Tylenol what the dose you've been taking?
Yeah, so I'm taking the 100 milligrams
The 100
every
milligrams? Is it possible to
sorry,
be 1,000? Okay, that makes more sense. And about every how many times a day?
I'm taking it every 6 hours around the clock.
Okay,
So 4 times.
6 hours. Okay. And does that help?
Yeah, it helps a lot. So I
Okay.
actually took some Tylenol about 30 minutes ago,
Mm-hmm.
um, and the pain it's much better now.
Excellent. And what makes the pain worse?
Really moving it around.
Okay.
So just even lifting my arm up hurts.
Okay.
Basic things around the house like cooking, it's hard to move around a lot.
Okay. And if you were going to describe your pain as the quality, so is it sharp, a numbness, a dullness?
It's more of a tenderness.
A
Like it's
tenderness.
like a tenderness, but deep in the shoulder.
Okay. And does it radiate anywhere? Does it go towards your neck or down your arm?
Most of the time it stays in that one spot, but if I am moving, I can feel it radiating a little bit down my arm.
Okay. And if you were going to put a number, so if you're going to rate the severity of your pain, that 0 being no pain at all, and 10 being worst pain that you felt, how would you rate that?
Right now, I would say it's a
Mm-hmm.
3 out of 10.
3 on 10. And before taking the Tylenol, how much was that pain?
Before taking the Tylenol, it was about a 7 on 10.
7 on 10. Okay, so it really does make a good difference.
Yes, it's really helping.
And how would you say how it impacts your day-to-day activities?
Well, just everything is harder, like even just getting dressed, doing the dishes, simple things. I mean,
Mm,
I'm able to get everything done, okay, but it just takes me a lot longer because I'm moving much more slowly.
okay. So this is since the last 2 days.
Yes.
Okay. And what do you think is going on? What's your understanding of having this pain?
Again, I'm not 100% sure, but I'm really thinking it had something to do with me lifting a heavy object days
Okay.
ago.
That can make a lot of sense. And do you have any other associated symptoms, meaning any headaches going on, any numbness or any tingling, maybe some neck pain or some back pain?
No,
No,
no, it's really
no other
just the
symptoms.
regular pain.
Okay, all right. Uh, so I'm going to move on now to the general survey. This is something that normally I don't necessarily verbalize, but for the purpose of this exercise, I think it's better off that I discuss out loud my findings. So your physical appearance, from what I see, is that you have quite a straight posture. You're able to continue to move around your hands. You talk with your hands. Your psychological appearance seems, your affect seems appropriate, and your mood appropriate to the situation right now. And you don't appear in any psychological or physical distress. Would you agree with these statements?
Yes.
Yes. So to continue, I do feel that you are a reliable source of information, which means that we're going to continue with the interview.
Okay, great.
Okay.
Hmm.
So now we're going to go on to your health history. So your any past history that you've had. Do you have any chronic illnesses such as diabetes, high blood pressure?
No.
No. Have you ever been hospitalized before?
Well, I was in hospital when I had my C-section for my daughter, but other
Mm-hmm.
than that, I haven't had any surgeries or anything like that.
Okay. So, so you had a C-section, which is also a surgery. Have you had any other surgeries?
No.
Do you have
Hmm.
any other children?
I do. I have two boys, and they're
Mm-hmm.
3 and 5 years old.
3 and 5. And were they a C-section or a vaginal delivery?
They were both vaginal deliveries.
Okay. And did you have any complications with your pregnancies?
No.
No. Aside for your 3 children, did you have any other pregnancies?
No, it was just the three pregnancies.
Okay. And were they term births, meaning born after 37 weeks?
Yes, all three of them were term.
Great. Perfect. And when was your last menstrual period?
My last menstrual period started 2 weeks ago.
And is it an irregular cycle?
It's a regular cycle every 28 days.
And is it a normal flow? Do you have any complications or any issues with that?
No, a normal flow.
Okay, great. Thank you. And do you take any prescribed medication?
I do not take anything prescribed.
Okay. How about any over-the-counter medication? Now, you did mention that you do take Tylenol presently, but do you take anything else?
Sometimes I do take Advil if I
Okay.
have a really bad headache or something like that, but it's very rare that I take it.
Okay. And when you do take it, what do you know the dose or the amount of tabs that you take?
I take 2 tablets.
2 tablets. And what would be the frequency that you would take it?
I mean, usually if I take one dose, if I take the 2 tablets,
Mm-hmm.
my headache subsides. But
Great.
if I ever have to take a second one, I always wait 6 hours in between.
Okay, great. Excellent. And do you take any vitamins or any herbal supplements such as St. John wort, vitamin D, vitamin C? To be taking any other types of supplements?
I do take vitamin C. I
Mm-hmm.
take it once a day.
Once a day. And do you know the dose?
I don't have the dose. It comes in like this little packet, and I just pour it into water and mix it, and I have that every morning.
Okay, great. Every morning, day. Perfect. Now, I'm going to ask you also, do you have any allergies?
I do have some allergies.
Okay.
I am allergic to peanuts.
Okay. And what happens when you have a peanut food allergy?
So I get a full body rash.
Okay. A full body rash. And what do you do to treat that reaction?
Well, luckily it has not happened since that one time because I really avoid peanuts altogether, but I do carry an EpiPen with me.
Okay. And do you know how you use the EpiPen?
Yes, so orange to the thigh and blue to the sky.
Great. And do you wear a metal bracelet?
I don't currently have one, but I'm thinking
Okay.
of getting one. I think it would, it's just a great idea and would make things safer.
Maybe we can discuss this after the whole interview and how you can have an access to one easily for you. That'd be
Sure,
interesting. Excellent.
definitely.
And do you have any other types of allergic reaction to medication or to any animals or environmental?
No,
No, and no other food allergies?
no,
No, great.
not that I know
Uh,
of.
okay. And do you have you ever been diagnosed with any communicable diseases such as hepatitis, tuberculosis, HIV?
No.
No. How about with any injuries or accidents in the past?
Well, when I was 12 years old, I broke my arm. But other than that, nothing.
Okay. And did you have any complications from breaking your arm?
No.
No. And as a child, did you have any childhood illnesses such as chickenpox, measles, mumps
I had chicken pox when I was 5 years old.
at 5? And did you have any complications from having chickenpox?
No.
No. Okay. And are your immunization up to date?
Yes, I think so.
Okay. And do you get the flu vaccine?
Yes, I get it every year.
I guess with 3 children and being a school teacher, it makes
Mhm.
you more at risk, and this is a good thing for you to have.
Exactly. And the flu is just so terrible. It's definitely something I can live without.
That's true. I agree with that. And do you have a family doctor or a nurse practitioner?
I do have a GP that I go and see.
Mm-hmm.
I have an annual checkup.
Okay.
But it's almost a year that I haven't gone, so I'm due for one soon.
Okay, great. So that'll be something maybe you should think of to follow up to make sure that you are able to see him soon.
Yeah, definitely.
Excellent. Now we're going to go on to your family history. Looking at 3 generations, so your siblings, your parents, and your grandparents, does anyone have any history of diabetes, high blood pressure, asthma, heart disease, or cancer?
Well, for both my parents, they are,
Mm-hmm.
my brother and my sister are well, no illnesses for them. And then
Mm-hmm.
my grandparents on my maternal side, they both have passed away already.
I'm sorry.
Um, Thank you. One was from chronic kidney disease, and the other was from colon cancer.
Okay.
Um, and this was all within the last 7 years, so they didn't pass away too far apart from one another. But luckily, on my other side, so on my dad's side, they're both alive, but they do have some illnesses, but everything
Mm-hmm.
under control. So my grandfather has diabetes and high blood pressure, and then my grandmother has high blood pressure.
Okay. Thank you. Okay, so we're almost done with the interview. What's left is to see how you're doing on a day-to-day basis, and could you explain to me what your perception of health is?
Oh, yeah. So personally, I think being healthy means feeling good in your body, physically and mentally. So that includes exercise,
Mhm.
having a pretty good diet, and taking some time to relax, some time for yourself.
That's an excellent way of perceiving health. And now you're telling me that you exercise. What type of activities do you do?
I do yoga. I really like yoga.
Mm-hmm.
So I do that about 3 to 4 times a week.
Mm-hmm.
And then I do try and bike to work when I can.
That's staying quite healthy, and I'm sure with three children, you also are staying quite active.
I get exercise just trying to take care of them.
I, I can account for that.
Yeah.
And how about do you have any issues? I know right now you did say that you're having trouble getting dressed and using your right shoulder and your arm. Is there any other issues with your mobility to be able to walk around or get around?
No, no other issues.
Okay. And do you use any assistive devices such as glasses or hearing aids?
I do have glasses for distance.
Mm-hmm.
Other than that, nothing.
Nothing aside from that, nothing. Okay, great.
Mhm.
And how would you do have three young children, taking that into consideration, on average, how many hours of sleep do you get a night?
I still get between 6 to 8 hours a night.
Mm-hmm. Oh, wow. Okay. And do you take the time to take naps during the day?
No, not usually.
No.
Maybe occasionally on a weekend, I'll take a nap for maybe 20 minutes, but other than that,
Mm-hmm.
no.
Would you consider yourself being well rested?
Yes. Yeah. Most of the days, yes. I mean, there's
That's
always the
great.
option you don't sleep well,
Yes,
but most of the days I'm well rested.
that's great. And how about if we go into your daily nutrition, daily food intake? What would a typical meals be within 24 hours?
Okay, so maybe I'll tell you what I ate yesterday.
Good
So
idea.
breakfast, yeah.
Mm-hmm.
So for breakfast, I had a bowl of mini wheats with milk, a peach, and a cup of coffee to start my day off.
Wow.
For lunch, I had a kale salad with avocado, cucumber, tomato, and flaxseed, and then an apple for dessert. And then for supper, I had this tomato meat pasta dish, and then I had some ice cream as well.
And this is something that would be typical for you as a meal.
Yes.
This is a very well balanced meal.
Oh, thank you.
And if we discuss about elimination, is there any problems with going to the bathroom for bowels or urine?
No, no issues.
Okay, no issues. You feel that your bowels, how many times a day or a week are you going?
Oh, I go once a day.
Once a day?
Mhm.
Okay. And is it formed?
Formed.
Formed. Great. And now you did tell me that you have a husband. How would you describe your relationship with your family and your friends?
I think I have a good relationship. I have a very close to my family and a close knit group of friends.
Hmm.
So I would say I get along with everyone, and I do have a support system for when I need one.
That's great. And are you a religious or spiritual person?
I wouldn't say I'm religious. Technically, I am Catholic, and so my family and I we go to church on the major holidays like Easter, Christmas. But other than that, not really.
Okay. And you mentioned at the beginning that you were a school teacher, that right now you're going in and planning the start of school, which could be stressful for people. And in times of stress, um, how do you cope or manage with it?
Usually, I will just try and exercise more that week. So I find the yoga
Okay.
very relaxing. So I will
Hmm.
just try and do a little bit more often.
Great. And do you smoke?
No.
No. Have you ever smoked?
Yes, I used to smoke, but I quit 10 years ago now.
Congratulations. It's not
Thank you.
easy to quit smoking.
Definitely not.
And how
It's
many cigarettes did you smoke and for how long?
I smoked about 5 cigarettes a day for a total of 7 years.
Okay, so congratulations, keep that up. Do
Thank you.
you drink any alcohol?
I do. I drink wine,
Mm-hmm.
maybe 1 to 2 glasses a week.
1 to 2 glasses a week, and so that would be how often? Do you know how much is a glass for you?
I think it's about 5 ounces.
Okay, okay,
Yeah.
5 ounces. Okay, and do you use any other substances or any other drugs?
No.
No. Okay.
Mhm.
And regarding your home and work environment, are there any hazards that you've noticed?
What is a hazard?
It could be either smell, noise, it could be air pollution.
No, no hazards.
No, great. And so going back to your relationship with your husband,
Mhm.
are you sexually active?
Yes.
Yes. And do you use any form of contraception?
We've been using condoms.
Okay. And when was your last STI screening?
Oh, I had that done near the beginning of my last pregnancy, so
Mm-hmm.
a little bit less than 2 years ago.
Okay, great. Would you consider yourself being financially stable?
Yeah, I think so.
Yes. Does your husband work also?
He works as well. He's an
Okay,
engineer.
great.
We're comfortable.
Perfect. So we're done with the questions of the functional assessment. I just have a few additional questions, and then we'll go on and make a few recommendations and see if you have any questions. So we can continue.
Sure.
Great. So have you noticed any changes in your skin, such as dryness or any new moles that have appeared?
No,
No. Any changes with your hair, like it falling out?
no, not yet.
No. Or nails being brittle?
No,
No. Um, have you noticed any shortness of breath?
no,
No. Any headaches?
no,
Any blurred vision?
no,
No. Have you noticed any sore throat or cough?
no,
No. Um, have you had any problems with your blood pressure or feel any chest palpitation or chest pain?
no,
No. Have you felt any tingliness or numbness in your extremities, like your arms and your legs?
no.
No. And do you have any issues with your recent memory loss?
Not that I can remember.
Not that you can remember. That's a good one.
I just
So
had to. Sorry, I'll let you continue with your interview.
It's always good to have a good joke. So if we were to wrap up a bit, after having this discussion and this conversation, I think it would be a good idea that I discuss with my colleague, physician, and nurse practitioner. Maybe you should come for a physical exam of your shoulder. It seems to be it seems to be bothering you a lot, and it's also affecting how you're functioning every day. Although the Tylenol is helping, and you said that you are putting some ice on it, which is great, which is an excellent coping strategy and a strength of yours. You are still having a challenge of when the pain comes back, to manage that, and your ability to take care of your 3 children and your activities of the day. So it would warrant for a good assessment, a physical assessment from that. I probably recommend you to continue with putting the ice about every 4 hours for 15 minutes. You said it's been since 48 hours, right? 2 days. So continue with the ice for the next day. And also, after that, apply alternate heat and ice.
Okay.
Okay. I'd also for 15 minutes, the same thing. If you'd like, I can email you the recommendations
Sure.
if that is easier for you to remember.
If it's just 15 minutes ice, 15 minutes every 4 hours.
Okay. And the other recommendation I'd ask is, do you sleep on your side?
Sometimes, yes.
Sometimes. To try to avoid sleeping on your right side until allow it some time to heal, until it starts healing. It will help in relieving the pressure also and waking up with more pain.
Okay. That sounds good.
So if you agree to this plan, I'm going to discuss with the physician and the nurse practitioner, and I would call you back by the end of the day to give you an appointment, what time you would come to the clinic.
Okay, perfect. Yeah, I definitely agree with the plan. It sounds like a good plan, and I would like to try all those things to relieve the pain.
Great.
So thank you.
So you should get a call from me by the end of the day. Until then, have a good day, and you'll hear back from me very soon.
Okay, great. Bye.
Bye.